We're here at the World Bank meeting for improving health efficiency in Washington, D.C. And today I'm joined by Dr. Meera Shekar, who is the global lead for nutrition at the World Bank. Today we're talking about the Scaling Up Nutrition Initiative and enhancing the efficiency of investment in global nutrition. Dr. Shekar, what exactly is the initiative and how is the World Bank involved?
So the Scaling Up Nutrition is more of a movement than an initiative per se. It's a political movement, and it was actually launched here at the World Bank, I want to say in April 2010, with a few key partners that were in the room at that time that included the US government through USAID, the government of Canada, the government of Japan, and the Bill and Melinda Gates Foundation with the World Bank. And the focus really was on, we know what to do. We have what we call the burden of knowledge. But there's very little that's being done at scale in countries. If we were able to do that, the evidence suggests that we will not only get benefits in terms of health impacts, but we will get benefits in terms of economic impacts and poverty reduction as well. So the movement was really to generate political will from partner governments, client governments in countries. So it's really evolved into something that we hope will have an impact, will help us scale up what works.
So exactly why is this initiative needed for improving the lives of children and families globally?
Nutrition up to now has been ignored by the larger development community. Despite the burden of knowledge that I spoke about, there's been very little that has been done in terms of investing in nutrition at scale. There are lots and lots of little pilot projects all over the world, but none of them adds up, or few of them add up to something that has impact at scale. And in countries where we actually have invested at scale, we've shown that you can get huge benefits. Senegal comes to mind, Peru comes to mind, Thailand comes to mind.
What existing approaches and tools for costing and financing are you discussing at the World Bank meeting?
Okay, so as part of the Scaling Up Nutrition movement, every country was asked to develop their national plans that they wanted to scale up. As they develop these plans, we look at those plans and you know, there's a lot in there. A lot of it is not necessarily affordable. And when we are looking for efficiencies in health outcomes, we need to be able to prioritize the investments that will give you the maximum bang for the buck. In addition, we're working with the Bill and Melinda Gates Foundation and the Children's Investment Fund Foundation and other partners to develop estimates of what it will cost to achieve the World Health Assembly targets. The effort is to see how we can maximize the efficiency, link the investments with potential impacts so that we can achieve those targets.
Looking to the future now, how can governments invest smartly and mobilize political will for improving nutrition in populations?
So the discourse in the global community right now is not just about getting more resources for nutrition or for health, but also about getting much more nutrition results for the resources that are invested in these areas. So the conversations that we are having with governments are around, first, mobilizing political will at the highest levels, and the Scaling Up the Nutrition, the SUN movement has really helped to mobilize that kind of high-level political will. And then the other conversation that needs to be had, because governments want results and they want them quickly. So the conversation we're having is, what is it that you can invest in that will get you the results that you're looking for? More nutrition for the money that governments will invest, both domestic financing as well as overseas development aid.
Thank you very much for your time, Dr. Shekar.
Thank you. Thank you very much.